Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert. I'm with Dr. Millicent Rovelo, who is a laser enthusiast with her facelifts, as am I. Mm-hmm. And we are here today. Dr. Rovelo, lasers?
Love them.
Can't get enough of them.
I mean, they really are the cure to what ails you. Like, just about everything in this world could probably be fixed with the right laser.
I know. And I know that you partake.
Oh, yes, I'm a fan.
You self-partake.
I self-partake.
Which is always scary to me.
Yes.
Please don't blast yourself into the next dimension or whatever you do with those lasers. I mean, every once in a while I'll come into the office and I'll see a numbing cream covered Dr. Rovelo walking around before 5 o'clock. I'm like, lasering something? Yep, time for me to do my Morpheus. Time for me to do, this, that, the other. So.
Yes, but specifically what we're talking about on this podcast is lasers in combination with a facelift. So this gets a lot of attention because it really is a very synergistic thing to do. And it's also a little bit, it can be a little bit tricky sometimes too. So the lasers that we're talking about can really be any kind of laser, but for the most part, we're talking about some kind of skin resurfacing or pigment addressing lasers. This is not going to necessarily be the tightening lasers like Morpheus or anything like that. We're talking about lasers that are going to address the surface concerns of the skin. And so this can be something like IPL, which addresses, or IPL or photofacial, addresses dark pigment areas of the face. Or it can be something like an erbium or a CO2 laser, which really resurfaces. It removes the superficial layers of skin, revealing really smooth, healthy skin underneath. Now, the more aggressive forms of resurfacing loursers like CO2 and even like a really aggressive erbium, they require some downtime. At least a week of your skin sort of sloughing off, very reptilian-like. And people don't really want to go out in public. They're swollen, they're red, they're sloughing. So there is sort of a downtime built into the more aggressive forms of resurfacing. But if you can do it at the same time as your facelift, when you already are going to be having downtime, that's when people get interested.
Well, what you're talking about are ablative lasers. Yes. So Morpheus is technically not a laser. It's radio frequency, right. Microneedling of different depths. Same with the Potenza Cynosure. I do have financial interest in that one, so I'm a consultant to Cynosure. But what we're talking about are ablative lasers, CO2, erbium, pixelated CO2, pixelated erbium. Right. Back in the Dizzy, when I was coming up with lasers, we didn't have pixelated lasers. We had big spots, and it was a little scary.
Your whole face would just be peeled off.
Yeah, I mean, it was a little scary because like a lot of my patients looked like they needed to go to the burn unit when we were done with them.
We don't do that anymore.
No. Now it's much more controlled. And the results, I think, are better because of that.
Right. They are better. They are more controlled. The healing process is better.
It's a whole different world. The lasers now have really solved a lot of the issues that were happening. Like, it was not uncommon. This was something I saw a lot of, and it's what got me away from CO2. I'm back to CO2 now. Like, I like CO2.
Yeah.
But what got me away from CO2 is you would see people walking around, and this was probably before I even went to medical school, with a line of demarcation at their mandible. And what that was from is they got a CO2 and it erased the pigment from their face. Mm-hmm. And there was a line where the laser stopped. And it was really clear.
Yeah.
And I would talk to, once I got to medical school and I started talking to plastic surgery patients, I was like, how does that happen? And they said, I had CO2 laser and then I lost all my pigment in my face. And so I have to put makeup on to blend it. And it just seemed like that was too much for me. So when I saw pixelated erbium, and this is in 2006 or so when I bought my first laser in Beverly Hills, I was like, I need something safe. And quite honestly, that pixelated erbium laser, and it is from Alma Lasers, which I am a consultant to Alma, that thing has just not caused me problems. It's really done great. And
it's a safe laser, but so the CO2 is like, especially the one that you're referring to, is like a one and done thing. You do that once, you're good for a decade. But the erbium ones, especially the pixelated erbium, you usually need like 4 to 6 sessions spaced 4 to 6 weeks apart to get the same effect that you would have from a full blast CO2. So yes, they are safer, but they do require a little kind of ramping up to get the full effect.
Yep.
The pixelated CO2 lasers that we have now, you can pretty much accomplish everything you want to in one setting, and they are safer. They are just a little more aggressive. You're going to see more of the downtime issues.
2 weeks can be, a pretty expected redness and downtime with CO2, whereas the pixelated erbium, you're talking about 4 or 5 days.
Yeah, it's a little bit less aggressive. But all of these treatments, they are addressing superficial skin pigment and texture. So that's going to be dark spots, sunspots. It's going to be fine lines, coarse skin, sort of a dull complexion, very superficial things. These are not in any way, shape, or form going to tighten your skin, give you any kind of pseudo facelift. I mean, it might be tight in the beginning because you're swollen, but like it's not going to actually give you a lift per se.
No.
Now, a facelift is exactly that. It lifts the face, it rejuvenates it, it does away with some of the jowling and the problems you see with aging. It does not address the surface of the skin. If you get a facelift, we'll put all the skin and all the soft tissue structure sort of back where they belong, but you're still going to have the same skin surface that you had coming in with. So if you have a lot of sun damage, if you have a lot of age spots, if you have a lot of fine lines, especially around the eyes or in the upper lip area, smoker's lines, not a great term because a lot of people have smoker's lines without ever
and they're not
smoked.
smoking.
It's just fine lines of the upper lip.
Yeah.
None of those things are going to be fixed with a facelift. So that's why combining a laser technology with a facelift really sort of gives you the whole package of rejuvenation.
Yeah, and that's what you want to do. Again, we talk about having an aesthetic plan for, over your lifetime, basically. And part of it is taking care of the skin, which includes doing lasers and photofacials. And photofacial is different from laser, and I'll explain it very quickly so you can understand. A photofacial is basically like taking
an IPL.
An IPL. Yeah, intense pulsed light. So what that is you're taking a light bulb, basically, and turning it up really high, putting a lot of energy through it, and it's basically showering the skin with every type of wavelength of light. It is not a laser. It is intense pulse light, IPL, photofacial, all the same thing. Think of it as like the light bulb in your lamp on super high power, and boom, it pops, flashes, and you get every wavelength. Laser is different because it's a collimated single wavelength light that is very regulated, and so you're getting. You
would almost say it's laser focused.
It's laser focused.
Okay.
That's good. So it's one wavelength of light that is being organized by whatever crystal that it passes through. However, it depends whether it's an erbium or if it's CO2 or if it's a Q-switch ruby laser, which is for red stuff. Any kind of red capillaries, red things. You use the VersaPulse laser or the V-beam. So again, no financial interest. That collimated light is very specific. So when you're doing pixelated erbium or pixelated CO2, it means that you're only letting points of the light get through the skin, and you're getting a pixel pattern, which the concept is that instead of injuring with the laser, because that's what a laser does, is it injures the skin in a very controlled fashion. Instead of getting a spot, maybe 5 millimeters in diameter, pop, hit the whole area, you're getting a point of light. And the injury is so specific and in a zone that the pixels of the injury coalesce and give you a much more even treatment, whereas the spots are harder to get an even treatment. I mean, there are good operators and bad operators for any laser, and depending on how much of it you do, you're either really great at it or you cause problems. And this is why with a facelift, you really want to get the right laser, the right type of light, the right type of energy. And I think the public's understanding of this is cursory at best, if not there's none. And I think a lot of the practitioners even have a cursory understanding of the lasers that they have in their practice. And this is something that when I hire PAs and nurses to do lasers and things in the practice, I said the one thing that you can really do to become excellent, to be really great at doing lasers, is to understand laser medicine.
Yeah.
Real light amplification system, like understand that's what this is. And you have to understand that that is all about knowing what it is that you're, firing at your patient, how strong or weak the energy is, and what type of a injury, a controlled injury are you trying to create to get that skin to rejuvenate as it recovers from the injury. It's very specific, and in the setting of a facelift, you want to nail this because it can really make things amazing with your facelifts.
Right, and historically that's been the concern because these lasers do have a risk profile, a complication profile associated with them. And the thought was that if you're doing a facelift, you're already compromising the blood supply to some degree because you're lifting the skin, you're elevating it, you're redraping it. And there was concern that if you added a laser on top of that somewhat compromised skin, that you could injure the blood supply, that you may have some complications. So some people would say, if you have really sun-damaged skin that you want to rejuvenate, maybe do a treatment or two before your facelift so that your skin's all ready to go. Or do your facelift, wait a period of time, 3 days, a week, 30 days, whatever, and then do your lasers. The problem, if you're doing the more aggressive versions like we talked about, the erbiums and the CO2s, is now you're have all these downtimes in a row where you can't really go out in public or you have to kind of baby your skin. And so we've started looking into, well, can you just combine them and can you do it safely? And there definitely are papers out there which have proven that yes, you can do this safely. In fact, it's done routinely now. You do have to know your laser medicine, as you said. You have to have someone that knows what they're doing. Frequently, you do have to dial down the settings a little bit on the lasers so that you don't cause any injury. So you do have to know what you're doing. But if you know what you're doing and you treat the skin appropriately, you can combine these modalities and really decrease your overall downtime from multiple periods of downtime to a single post-operative period. And the results are spectacular.
Nailed it. You got it. I mean, that is the message. Be specific. I mean, we do a lot of this. So and I have, typically I have my PA Orla who, is lasering everybody on the streets of Beverly Hills practically. I'll have her come in and do the lasers just because she does it all the time.
Same.
But, I do it too. And it's not, the devices now are so controlled and specific. It's difficult to not give a good treatment.
Yeah,
I mean, it is. And that, by the way, that's part of the problem is because you could take a nurse who literally finished nursing school and say here's the erbium pixel, do this. And they're gold. They aren't going to hurt anybody. The machine won't let you.
Yeah.
And so that is part of the problem. But I just really, I grill my PAs and nurses and just say, you got to know your laser medicine. It makes such a difference and you're going to do so much better for your patients. And the whole goal is to get great results for your patients. I mean, that's why we do this.
It's great results. And it really just turns up the notch on those facelift results by so much, because if you can rejuvenate the skin and get rid of those fine lines and get that glowing skin, oh my gosh, it just turns your facelift results up by 100 watts. It's amazing. It's so good.
And it's also the sort of making the case for, the deep plane and, the SMAS facelifts, because, then you can kind of do a composite-ish facelift. And I on certain patients, I'll do a composite where I leave the skin and the SMAS sort of attached and do the old Skoog facelift. I'm sorry to all of you out there, plastic surgeons who think you invented the deep plane facelift, who are publishing on your websites right now that you invented this technique. Tord Skoog wrote the book about it in 1971 or 2 or 3, and it's been around forever. But I did these composite facelifts as a resident very frequently because I had younger patients. That's who was coming to me for facelifts. There were nurses and stuff who agreed to let me operate on them. But when we laser them, you never had any issues because you're keeping everything attached.
Yeah.
When you have a little bit older patient, you have to I'll separate the skin a little bit more to get it to redrape. So, it's all about the thought process, the diagnosis, what you got to do, and how you're going to get these patients there to get a great result. And I will tell you that the younger you have the facelift and you do it with the lasers, the better the results are going to be, and you're never going to look like an old lady. That's for sure. You can really stave that off for good, especially these gals that are having the facelifts in their 40s, their early 40s, mid 40s. They're not going to get to the point where they get gels. They're gonna miss that boat completely. Which I don't know anybody that wants gels. Do you?
No.
Yeah. So in general, that's a good thing. But it's it is really key. You want to know the laser medicine. And so when you're talking to your surgeon about what else can we do, this is one of the things. And doing a erbium pixel 2 months before a facelift isn't a bad idea if you can get it in. A lot of times people show up, they want to do it right away, and it's like, all right, we'll do it while you're asleep, and that's fine. But, typically with the CO2, you're going to kind of crank it out, and that's a one-shot deal.
Yeah. I mean, that's basically it. It's safe to do. I highly recommend doing it if you feel like you need it, if your skin needs that extra love and attention. Very little downtime, very little risk to it if you're already doing it with a facelift, because you're already going to be hiding from the public for a week. It does make the recovery a little bit more painful, literally and figuratively, because you do get more swollen. You do have that whole skin sloughing thing happening at the same time. So it can be a little bit more of an obnoxious recovery, but you're combining it in one and you're really dialing up the result. So
I like that, obnoxious recovery.
I mean, in full disclosure. Yeah.
It is, but you want to do it. It's all good.
Yeah. It's worth it. The results are worth it.
Yeah, and then going forward after the facelift and after the lasers, you want to keep up with it. I mean, it's not it's not a one and done. I mean, it is you have to develop a can-do aesthetic attitude, to quote Ozzy Man.
I mean, time, age, gravity, the sun, pollution, all of this stuff is going to continue to work on the skin and surface structures of your face. So you have not gotten away from doing Botox, Morpheus, lasers, IPLs, photofacials. You will still need to maintain, but you have set yourself up in a much better starting position if you do the above first.
I think that sounds good.
Yeah. When are we doing yours, doctor? You literally, before we started this podcast, sat down and groaned, I need so much plastic surgery. I'm right here.
I don't know.
Right
I know, but
here.
It's like, I have to have time.
Are you saying that you should combine your procedures?
Yeah, I know. Look, I am ready. I think it's time to do at least get the lids out of the way. That's got to happen. Doing the whole face and neck thing, I don't know. It's a beast to me. I have to take a lot of time to heal that, and that's the problem. It's not like I got kids, man. I'm working like a dog. They require some funding. I don't know if you have children or you had to pay. I know you do, but it's like that stuff just keeps coming at me.
I know. Whenever you're ready.
All right. Well, in that case, this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.